Hello and welcome to our video on obesity. According to the World Health Organization, obesity has tripled worldwide since 1975, and in the United States, it affects more than 1/3 of adults. But what exactly is obesity, and why is it such a big problem? In this video, we'll explore the causes, effects, and solutions to obesity. 1. Definition and causes of obesity. Obesity is a medical condition where a person's body mass index, BMI, exceeds 30. BMI is calculated by dividing weight in kilograms by height in meters squared. Causes of obesity are complex and include a combination of genetic, environmental, and lifestyle factors. Some people may be genetically predisposed to obesity due to their family history. Environmental factors such as access to unhealthy food options and sedentary lifestyles also contribute to the problem. Lifestyle factors such as unhealthy eating habits, lack of physical activity, and stress can also cause weight gain and obesity. Certain medical conditions can also contribute to obesity, such as hypothyroidism, Cushing's syndrome, and polycystic ovary syndrome. Obesity can also be classified into 3 categories based on the degree of obesity. Class 1. BMI of 30 to 34.9. Class 2. BMI of 35 to 39.9. Class 3. BMI of 40 or higher. 2. Effects of obesity. Obesity is associated with numerous health problems, including heart disease, stroke, diabetes, cancer, joint problems, and sleep apnea. These conditions can have serious consequences and even be life-threatening. Heart disease is the leading cause of death in the United States, and obesity is a major risk factor. Excess body weight can increase blood pressure, cholesterol levels, and inflammation, which can damage the heart and blood vessels. Diabetes is also a major health problem associated with obesity. Obesity increases insulin resistance, which can lead to high blood sugar levels and type 2 diabetes. Diabetes can cause a wide range of health problems, including kidney disease, nerve damage, and blindness. Cancer is another serious consequence of obesity. Obesity is linked to an increased risk of several types of cancer, including breast, colon, and kidney cancer. Joint problems such as osteoarthritis are common in obese individuals due to increased pressure on joints. This can cause pain, stiffness, and limited mobility. Sleep apnea is a sleep disorder that causes breathing to repeatedly stop and start. It's common in obese individuals due to excess fat deposits in the upper airway. Sleep apnea can cause daytime fatigue, headaches, and other health problems. In addition to physical health problems, obesity can impact mental health, leading to depression, anxiety, and low self-esteem. It can also affect quality of life, as well as work productivity and social relationships. Obesity can also have economic consequences, as it can lead to higher healthcare costs and decreased productivity. 3. Solutions to obesity. Prevention is key, and involves adopting healthy habits early on, such as eating a balanced diet and engaging in regular physical activity. The American Heart Association recommends at least 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise per week, in addition to strength training exercises. Dietary changes can help prevent and treat obesity. This includes reducing calorie intake, increasing intake of fruits and vegetables, and reducing consumption of processed and high-fat foods. Medications can also be used to treat obesity. These medications work by suppressing appetite, increasing feelings of fullness, or reducing the absorption of fat. However, these medications should only be used under the guidance. Thanks for watching our video on obesity. If you found this information helpful, please like and subscribe to our channel for more health-related content. And as always, please consult with a healthcare professional before making any changes to your diet or exercise routine.